Hey everyone, and welcome back for another deep dive. Today we're going to be talking about something that I'm sure you see pretty frequently in your lab reports. Lower urinary tract infections, UTIs.
Yes.
And in particular, we're going to be focusing on acute cystitis.
Okay.
We're going to be using a really great resource for this.
Okay.
The World Health Organization's Aware Antibiotic book.
I'm familiar with that one, yeah.
Yeah, it's fantastic. I think especially for our audience, they're medical microbiologists.
Right.
So this is going to be right up their alley.
Absolutely.
So, UTIs, they might seem pretty simple at first glance.
Sure.
But as we kind of dig deeper, you'll see there are some really interesting nuances.
Right.
Especially, when it comes to diagnosing them and treating them, especially, in this age of antimicrobial resistance.
Absolutely. UTIs are incredibly common, and AMR is a growing concern.
It is. So to kind of get us all on the same page, let's define exactly what a lower UTI is. In particular, acute cystitis, since that's our focus today.
So a lower UTI, and specifically acute cystitis, is an infection that affects the bladder. It's often categorized as either complicated or uncomplicated.
Right. And the Aware book really points this out. They have a list of factors that could make a UTI more complicated. Things like obstructions, catheters, pregnancy, even diabetes.
Yeah, those are all important considerations.
But it doesn't mean that if you see one of these factors, it automatically becomes a complicated infection, right?
You're absolutely right. It's not a simple checklist. A pregnant woman with a straightforward UTI might not need the same interventions as, say, someone with a catheter who also has a history of recurring infections.
Right. It's about the whole picture, not just individual factors.
Exactly. You have to look at the patient as a whole.
So then, how does this distinction between complicated and uncomplicated UTIs actually impact what you do in the lab? How does it change things for you?
Well, it can affect a lot of things. The urgency of getting a culture, the initial antibiotic choice. For a complicated UTI, you might start with a broader spectrum antibiotic while waiting for the culture results.
Okay.
An uncomplicated one might allow for a more targeted approach.
Gotcha. So let's move on now to what's probably going to be seen in the lab. What are some of the key signs and symptoms of a lower UTI? The things that would actually prompt someone to seek medical attention.
Sure. Well, the classic presentation is dysuria, that painful burning sensation when urinating.
Right.
Along with that, there's often frequency and urgency.
Okay.
So they need to go often and they need to go now. And there can be some discomfort or pain in the lower abdomen.
Right.
Sometimes you might even see hematuria, which is blood in the urine.
Okay. Now, I know from my own experience that it can be really tricky to diagnose a UTI just based on symptoms, especially in women.
Absolutely.
And elderly patients.
For sure.
What are some of the challenges there?
Well, with women, it's super important to rule out any vaginal sources of symptoms.
Okay.
Those can easily mimic a UTI. And with elderly patients, well, their baseline might already include some urinary issues. So it's more about noticing any acute changes that could point to an infection.
That makes sense. And I know this is a common misconception, but cloudy or smelly urine by itself, those things don't necessarily diagnose a UTI.
No, not at all.
Right. We see bacteria in urine all the time, and it doesn't always mean there's an infection going on.
Absolutely. That's why it's so important to look beyond just the symptoms.
Right. That's where the microbiology tests come in.
Exactly. They're crucial for confirming a real UTI.
Okay. So let's talk about urine cultures. When are they absolutely necessary for diagnosing a lower UTI, and when can we maybe skip them?
So a urine culture is essential when we suspect a complicated UTI, especially in cases with those risk factors we talked about earlier.
Okay.
It's also a must for children and anyone with recurring UTIs.
So it helps us really pinpoint what's causing the infection.
Exactly. We identify the culprit, and we can tailor the treatment based on its susceptibility profile.
Gotcha. Now, I imagine getting a clean catch urine sample, especially from a child, can be quite a challenge for clinicians.
It can be tricky.
Are there any alternatives for those situations?
Yeah, sometimes we have to consider other options like suprapubic aspiration
Okay.
or catheterization, but, those procedures come with their own risks.
Yeah.
They should only be used when absolutely necessary.
Yeah. So this brings us to something I think is often overlooked, asymptomatic bacteriuria.
Right.
Can you explain what that is and why it's not usually something we treat with antibiotics?
Sure. Asymptomatic bacteriuria basically means finding bacteria in the urine, but there are no symptoms.
Okay.
Often it's just harmless colonization. Treating it with antibiotics could actually do more harm than good.
Okay. How so?
Well, it can disrupt the natural balance of the microbiome, and it can contribute to antibiotic resistance.
Right. That's a really important reminder for everyone listening. Don't jump to antibiotics just because you see some bacteria in a urine sample.
Exactly.
Always look at the clinical picture.
Absolutely.
Is the patient having symptoms?
Right. It's all about responsible stewardship, using antibiotics judiciously.
Okay. So we've talked about cultures. What about other lab tests like urinalysis
Yeah.
and blood tests? How do those fit into the whole diagnostic process for lower UTIs?
Well, urinalysis can be really helpful. It can detect signs of infection,
Okay.
like bacteriuria and pyuria,
Okay.
which is the presence of white blood cells in the urine.
Right.
Blood tests, on the other hand, they're less useful for lower UTIs.
Really? Okay.
The results are usually normal.
Gotcha. So let's delve a little deeper into urinalysis.
Sure.
What kind of findings would really make you suspect a UTI? What are you looking for?
Well, things like leukocyturia, that's an elevated white blood cell count,
Okay.
a positive leukocyte esterase test, and positive nitrites, those can all point toward a UTI.
Okay.
But, and I can't stress this enough, these findings alone, without the symptoms, aren't enough to start antibiotics.
It really is about putting all the pieces together then. The clinical presentation, the lab results,
Right.
and the patient's history. So what about imaging? Is that something you order routinely when you're diagnosing a lower UTI?
Not routinely. Imaging might be helpful in some cases, though. Like if we suspect there's an underlying abnormality of the urinary tract, especially in children or men, it can help us identify any structural issues.
Gotcha. So now let's move on to the part I'm sure everyone's been waiting for, treatment. And this is where things get really interesting, especially for our medical microbiology audience.
Absolutely. And it's important to remember that treatment goes beyond just antibiotics. Pain management is a crucial part of managing lower UTIs.
Right, you want to treat the whole patient.
Yeah.
So let's start with analgesic options.
Okay.
What does the WHO Aware book recommend for dealing with that UTI discomfort?
Well, the book highlights ibuprofen and paracetamol as effective pain relievers.
Right.
For ibuprofen, the recommended dose for adults is 400 milligrams every 6 to 8 hours, with a maximum daily dose of 2,400 milligrams. For children, the dosage is weight-based, typically 10 milligrams per kilogram every 6 to 8 hours. For paracetamol, adults can take 1,000 milligrams every 4 to 6 hours, not exceeding 4,000 milligrams a day. For children, it's usually 15 milligrams per kilogram every 6 hours.
Okay, so that takes care of the pain. What about antibiotic treatment? What are the recommended approaches?
In most cases, we start antibiotic treatment empirically,
Okay.
based on the patient's symptoms and a positive urinalysis or urine culture. Once we have the susceptibility results from the lab, then we can refine the choice if needed.
That makes sense. And how long does it usually take for patients to see improvement once they start antibiotics?
Typically, we expect clinical improvement within 48 to 72 hours of starting treatment.
Okay, so a couple of days.
Yeah, it's really important to tell this to patients so they have realistic expectations.
Right, you don't want them getting discouraged and stopping their antibiotics too soon, or
Sure.
worse, trying to self-medicate.
Exactly. Patient education is key in the fight against antibiotic misuse, which, as you know, is a huge factor in antibiotic resistance.
Absolutely. And speaking of resistance, we can't talk about UTI treatment without acknowledging that challenge. How does antimicrobial resistance factor into your decision-making when you're selecting an antibiotic?
It's a huge consideration. We need to be aware of local resistance patterns,
Right.
but it's important to remember that data from hospital microbiology labs may not accurately reflect what's happening in primary care settings, where most UTIs are treated.
So you need to use the data that's most relevant to where the infections are actually being treated.
Exactly.
Okay. So according to the WHO Aware book, what's considered the first-line antibiotic for acute cystitis?
The book recommends nitrofurantoin as the first-line treatment for 5 days. It's generally pretty effective. It even works against most ESBL-producing isolates. But there can be challenges with availability, especially the pediatric formulation.
And I think the book also lists some alternative antibiotic options, right?
Yes, it does.
Amoxicillin+clavulanic, sulfamethoxazole+trimethoprim, trimethoprim.
Those are all possible options depending on the specific patient, local resistance patterns, and any potential contraindications.
So it's about choosing the best tool for the job, considering all these factors.
Absolutely. Personalized medicine.
Okay. Let's shift gears now and talk about what actually causes these infections. Can you break down the typical pathophysiology of a lower UTI in a way that's easy to understand?
Sure. So usually the infection starts when pathogens ascend the urethra from the perineal area and they make their way up to the bladder.
Okay.
But just because there are microorganisms in the urine, that doesn't automatically mean there's an infection.
So what determines whether that actually develops into a full-blown UTI?
It's a complex interplay between the organism, the patient, and the environment. The virulence factors of the pathogen definitely matter.
Okay.
And then underlying diseases in the patient can compromise their immune system, making them more vulnerable.
So things like uncontrolled diabetes or even having a urinary catheter can increase the risk.
Exactly. And don't forget about external factors. Things like frequent sexual activity or even certain types of birth control can also play a role.
It's like a whole web of factors coming together.
Exactly. It's about understanding how these factors interact to influence someone's susceptibility to UTIs.
Okay, so let's zoom out now and look at the bigger picture, the epidemiology of lower UTIs. Just how common are these infections? Give us some numbers.
They're incredibly common, more than people realize. In 2017 alone, the Global Burden of Disease study estimated a staggering 274 million new cases of UTIs globally.
Wow, that's a huge number. And I know women are more likely to get UTIs than men. Why is that?
It mostly comes down to anatomy. Women have a shorter urethra than men, which basically gives bacteria quicker access to the bladder.
Shorter trip for the bacteria, makes sense.
Yeah.
But after age 65, the rates in men and women seem to become more similar. What explains that?
Well, as men age, prostate enlargement becomes more common, and that can actually increase their risk of UTIs.
So it's like their anatomy is changing as they age.
In a way, yes, and it makes them more susceptible to UTIs.
It's crazy to think that more than half of all women will experience at least one lower UTI in their lifetime.
It's a very common condition, and it's important to remember they're not always just one-off events.
You're right, UTIs can recur.
The recurrence rate is very high, especially in young women. About 70% experience a recurrence within a year after their first episode.
So we've got age and sex as major risk factors. What are some other things that might make someone more prone to developing a UTI?
Oh, there's a whole list. Anatomical and functional abnormalities of the urinary tract, anything that leads to incomplete bladder emptying, like an obstruction or nerve damage, those increase the risk. We also see higher rates in people with renal insufficiency and urinary incontinence.
And what about the immune system? Does that play a role in UTI susceptibility?
Definitely. Conditions that weaken the immune system, like poorly controlled diabetes or neutropenia, increase the risk of UTIs.
Makes sense. And as we touched on earlier, any instrumentation of the urinary tract, like catheters and stents, is also a significant risk factor.
Right. Anything that disrupts the normal flow of urine can make it easier for bacteria to take hold.
So let's talk about the usual suspects behind these UTIs.
Okay.
What are the most common pathogens that we find?
Most lower UTIs are caused by bacteria that are normally found in the gut.
And the most common one is?
E. coli. It's responsible for over 80% of lower UTI cases.
So when we do a urine culture, what are some of the other pathogens we might find besides E. coli?
Well, if we look at table 23.1 from the WHO Aware book, we see some other key players: Klebsiella pneumonia, Proteus mirabilis, and Staphylococcus saprophyticus. That last one is especially common in young women.
Interesting.
And then there's Streptococcus agalactiae, Enterococcus species. And of course, we have the multi-drug-resistant troublemakers, Pseudomonas aeruginosa, and Acinetobacter baumannii.
Those are the tough ones.
They can be, especially in patients who have recently been on antibiotics.
The book mentions that data on causative organisms in low and middle income countries is somewhat limited. Any thoughts on that?
It's true that we have less data from those regions, but even if there are variations in the proportion of less common pathogens, it's unlikely to change how we manage these infections.
Okay.
Though there is one interesting regional exception.
Oh, what's that?
Schistosoma hematobium.
Okay, I'm not familiar with that one.
It's a parasite, and it can actually mimic UTI symptoms.
Really?
Yeah, it's something to keep in mind if you're working in parts of Africa and the Middle East where this parasitic infection is common.
Okay, so important for certain geographic locations.
Yes. It can cause hematuria and other symptoms that look like a UTI, especially in children. So careful diagnosis is needed in those regions.
So any final thoughts on diagnosing lower UTIs? Any pearls of wisdom for our listeners?
I think the key takeaway is that it's not always straightforward. You have to consider the whole picture to get an accurate diagnosis.
Right, all those different pieces we talked about.
Exactly, and don't jump to antibiotics.
Right, make sure it's really necessary.
Absolutely.
Yeah.
Responsible antibiotic use is crucial.
Okay, well, let's switch gears now and talk about some of the treatment options for lower UTIs.
Sounds good.
Starting with
Topical treatments. Actually, the Aware book doesn't really go into detail about topical treatments for lower UTIs.
Interesting. So it seems like the focus is mainly on systemic approaches like antibiotics. And we talked about the different antibiotic options earlier. But let's dive a little deeper into treatment duration. Is there a standard length of treatment, or does it vary depending on the patient?
It definitely varies. The book emphasizes that treatment duration should be tailored to each individual patient.
Okay, so what are some of the things you consider when you're deciding on the length of treatment?
Well, the specific antibiotic being used, the patient's age and sex, and whether the patient is pregnant, those are all important factors.
Okay. Can you give us some general guidelines for different patient populations?
Sure. For children and non-pregnant women, shorter treatment courses are usually recommended.
Okay.
Typically around 3 to 5 days, depending on the antibiotic.
Okay.
But for pregnant women, we extend that to around 5 days to make sure the infection is completely gone.
Gotcha.
And for men, treatment generally lasts a bit longer, often around 7 days.
So it's not just a one-size-fits-all approach.
Exactly. It's about personalized medicine.
Yeah.
Tailoring the treatment to each individual patient to get the best results.
Right. Right. The Aware book also outlines some really important clinical considerations. For example, it explicitly states that antibiotic treatment should be initiated if there's a compatible clinical presentation, A&D, a positive test result.
Right. So both the symptoms and the lab results need to point towards a UTI.
Exactly. We don't want to be throwing antibiotics around unnecessarily. But what about situations where you can't get those lab results right away? Do you wait? Or do you act based on clinical suspicion alone?
The book does acknowledge those real-world scenarios. And it suggests that if diagnostic testing isn't readily available, treatment can be started based on a strong clinical suspicion.
Okay, so it's a judgment call sometimes.
It is. You have to weigh the need for prompt treatment against the need for responsible antibiotic use.
Makes sense. The book also stresses that you should see clinical improvement within 48 to 72 hours after starting antibiotics.
Right. It's important to communicate that to patients so they know what to expect.
Right. You don't want them to stop their medication early because they think it's not working.
Exactly. Or even worse, start self-medicating with something else.
Absolutely. Patient education is so important.
It is. We need to make sure patients understand why we're making certain treatment decisions and what they can do to help themselves get better.
And one of the most important messages is to avoid self-medicating with antibiotics.
Absolutely. That's a huge problem globally, and it's a major driver of antibiotic resistance.
So let's talk about some of the specific antibiotic options outlined in the Aware book. We've talked about Nitrofurantoin as the first-line choice.
Right.
But what are some of the alternatives, and what are the key considerations for each one?
Okay, so one alternative is amoxicillin+clavulanic acid.
Okay.
It's a broad-spectrum antibiotic, and it can be effective for UTIs, but you have to remember that ESBL resistance is increasing.
Right, so it's not always the best choice.
Exactly,
Right.
especially in areas with higher rates of ESBL-producing bacteria. Another option is sulfamethoxazole+trimethoprim. That's a classic combination for UTIs.
Yeah, I've heard of that one.
But we're seeing more resistance to this combination now, and it's not effective against most ESBL-producing isolates either.
Okay, so not as reliable as it used to be.
Unfortunately not. And you also have to remember that it's contraindicated during the first trimester of pregnancy.
Oh, right, I forgot about that. So definitely not for everyone. What about trimethoprim on its own? Is that still a viable option?
It can be, especially for uncomplicated UTIs. But similar to sulfamethoxazole+trimethoprim, we're seeing rising resistance to trimethoprim too. So you have to weigh the benefits against the risk of resistance.
It seems like we have to be really careful about which antibiotic we choose.
We do. It's about choosing the right antibiotic for the right patient at the right time.
Okay. Now let's talk about urine cultures again.
Okay.
You mentioned how important they are for identifying the specific bacteria causing the infection and its susceptibility profile. But what happens when a culture comes back and the bacteria is resistant to the antibiotic the patient's already on?
That's a great question, and it's something we deal with all the time in clinical practice. The decision to change antibiotics based on a culture and sensitivity report isn't always clear-cut.
Okay.
You have to consider a few things. How's the patient responding to the initial treatment?
Okay.
How severe is the infection? And what are the potential risks and benefits of switching to a different antibiotic?
So it's not a simple yes or no answer.
It's not. It requires clinical judgment. You really have to look at each case individually.
Right, because sometimes the patient might be getting better even if the culture shows resistance.
Exactly. And in those cases, it might make sense to stick with the current treatment and just watch them closely.
Okay.
But if the patient isn't getting better, or if the infection is really bad, then you definitely want to switch to a different antibiotic based on the susceptibility results.
And I imagine it gets even more complicated when you're dealing with those multi-drug resistant organisms like Pseudomonas aeruginosa and Acinetobacter baumannii.
Oh, absolutely. Those cases are much more challenging, and we have to be really careful about how we use antibiotics. We might need to consider combination therapy or consult with infectious disease specialists to make sure we're giving the patient the best possible treatment.
So managing UTIs, especially with the threat of antibiotic resistance, it's a constantly evolving challenge.
It is, and it really highlights the need for collaboration between different healthcare professionals.
Okay, so let's talk a little more about the bacteria that cause UTIs. We know E. coli is the most common one, but what makes it such a successful UTI-causing pathogen?
Well, E. coli is very adaptable and resilient.
Okay.
It has a bunch of virulence factors that help it colonize the urinary tract and avoid being eliminated by the host's immune system.
Okay.
For instance, it has fimbriae. They're like little hair-like structures that allow it to attach to the lining of the bladder.
So it can really hang on.
Exactly. And it also produces toxins that can damage the bladder lining.
Oh.
And to make things even worse, some strains of E. coli have become resistant to multiple antibiotics.
So those are really tough to treat.
They can be.
That's why it's so important to do those susceptibility tests in the lab.
Absolutely. We need to know exactly what we're dealing with so we can choose the right antibiotic.
Okay. So we know E. coli is the main player. But what about those other less common UTI-causing pathogens? Do they have similar tricks?
They do have their own ways of causing trouble. Klebsiella pneumonia, for example, is known for forming biofilms.
Oh, what are biofilms?
They're like slimy layers of bacteria.
Okay.
They can protect bacteria from antibiotics and the host's immune system.
So it's like a shield.
Exactly. And then there's Proteus mirabilis. It can produce an enzyme called urease.
Okay.
And that breaks down urea in the urine, which makes the urine more alkaline.
Okay.
And that can actually lead to the formation of kidney stones.
So not just a UTI then. You can have other complications.
Right. It can get pretty complicated.
Okay. Now, I want to go back to the AWARE book for a minute. It emphasizes that antibiotic treatment should be reassessed once you have the susceptibility results.
Yes, that's important.
Why is that so crucial?
Well, remember, the initial antibiotic choice is often empirical.
Right. Based on the most likely culprit.
Exactly. But once we know exactly which bacteria is causing the infection and what it's susceptible to, we can adjust the treatment accordingly.
So it's all about making sure the patient is on the most effective antibiotic.
Precisely. We want to target that infection and get rid of it as quickly as possible.
Okay. The book also mentions that antibiotics typically shorten the duration of symptoms by about 2 days. But I imagine it's important to let patients know that they'll still have some discomfort for a few days.
Oh, absolutely. Antibiotics aren't a magic cure.
Right.
They help speed up the healing process, but they don't provide instant relief.
It's important to set realistic expectations then.
It is. We need to make sure patients understand the process and are prepared for what to expect.
Okay, so we've talked about treatment. What about preventing UTIs in the first place? Are there things patients can do to reduce their risk?
There are. One of the simplest things is staying well hydrated.
Okay, good old water.
Drinking plenty of water helps flush out bacteria from the urinary tract.
So it's kind of like washing them away.
Exactly. Another important tip, especially for women, is wiping from front to back after using the toilet.
Okay, I've heard that one before.
It's simple, but it can make a big difference in preventing bacteria from spreading from the anal area to the urethra.
Makes sense. What about cranberry products? There's been a lot of talk about cranberries and UTIs. Do they actually help?
The research on cranberries is a bit mixed.
Okay.
Some studies show that certain compounds in cranberries can prevent bacteria from sticking to the bladder wall, which could help prevent infection.
So it might be worth a shot for some people.
Yeah, it might. But keep in mind that cranberry juice can be high in sugar, so it's not for everyone. Cranberry capsules might be a better option for people who are watching their sugar intake.
Good point. So beyond hydration, hygiene, and maybe cranberries. What about other lifestyle factors like diet and exercise?
Those things can definitely impact your overall health and your immune system.
Okay.
A healthy diet and regular exercise can help boost your immune system, making you less susceptible to infections in general.
Right, makes sense.
And managing stress is also important.
Okay. How does stress play into it?
Well, when you're stressed, your immune system doesn't function as well.
Oh, wait.
So you're more likely to get sick, and that includes UTIs.
So it's about taking a holistic approach to your health, not just focusing on one specific thing.
Exactly. It's about the big picture.
Okay. Now, I want to shift gears a little bit and talk about the role of the lab in managing UTIs.
Okay.
What are some of the challenges and opportunities you see for microbiology labs in this area?
I think one of the biggest challenges is keeping up with antibiotic resistance.
Right, because it's always changing.
Exactly. It's constantly evolving, and we have to be constantly adapting.
Okay. So what kind of things do labs need to do to stay ahead of the curve?
Well, we need to be using the latest testing methods. We have to make sure our reporting on antimicrobial susceptibility is up to date.
Right, so clinicians have the most accurate information.
Exactly. And we need to make sure we're doing everything we can to prevent contamination in the lab.
Okay, how so?
Well, urine cultures are really important for diagnosing and managing UTIs,
Right.
but they can be easily contaminated.
Okay.
And that can lead to false positive results.
Right.
And then potentially unnecessary use of antibiotics.
So quality control is super important.
It is. We have to be very careful in the lab to make sure we're getting accurate results.
Okay. Now, what about opportunities? Are there any exciting new technologies on the horizon for UTI diagnostics?
There are. One area that's really promising is the development of rapid diagnostic tests for UTIs.
Oh, tell me more.
These tests could give results in minutes, right there at the point of care.
Wow, that would be amazing.
It would. It would allow for much faster treatment and potentially reduce unnecessary antibiotic use.
That would be a game changer. So it sounds like there's a lot to look forward to in the fight against UTIs and antibiotic resistance.
There is. It's a dynamic field, and it's an exciting time to be working in this area.
Okay. Now, let's talk about a specific group that can be tricky to manage when it comes to UTIs. Children.
Okay.
What are some of the challenges in diagnosing and managing UTIs in kids?
Well, children, especially babies and toddlers, can be really hard to diagnose. Their symptoms are often very general,
Okay.
and they might look like other conditions.
Right. They can't always tell you what's wrong.
Exactly. So we have to look for more subtle signs, like fever, irritability, changes in their urine, or if they're not feeding well.
This is a bit of a puzzle.
It can be. And then, as we mentioned before, getting a clean urine sample from a child can be really difficult. Sometimes we have to use a catheter or do a suprapubic aspiration,
Right.
which can be stressful for everyone involved.
Yeah, I can imagine. And I would think that deciding whether or not to use antibiotics in children is even more complicated, given the potential long-term effects of early antibiotic exposure.
Absolutely. We have to be very careful about using antibiotics in kids.
Okay.
We want to treat true infections, but we also want to minimize unnecessary antibiotic use.
Because it can lead to other problems down the road.
Right. Studies have shown that early antibiotic exposure can increase the risk of allergies, asthma, and other health issues later on.
So it's a balancing act.
It is. You have to weigh the benefits against the risks. And it's really important to have good communication between the pediatrician, the microbiology lab, and other healthcare providers.
Okay. Now, what about UTIs in pregnant women? What are some of the unique challenges there?
Well, UTIs are actually pretty common during pregnancy.
Really?
Yeah. Hormonal changes can affect the urinary tract,
Okay.
and that can make women more prone to infections. But the problem is, if a UTI isn't treated during pregnancy, it can be really serious for both the mother and the baby.
Oh, wow. What are some of the potential complications?
Well, an untreated UTI can turn into a kidney infection,
Okay.
and that can lead to premature labor,
Right.
low birth weight,
Mhm.
even sepsis, which is a life-threatening condition.
So early diagnosis and treatment is critical during pregnancy.
Absolutely. And we have to be really careful about which antibiotics we use. Some antibiotics can be harmful to the developing fetus.
So again, good communication between the clinician and the lab is essential.
It is. We have to work together to make sure the mother gets the safest and most effective treatment.
Okay. Now let's talk about something that's often overlooked, the psychological impact of recurrent UTIs. How do these infections affect people's quality of life and their mental health?
Recurrent UTIs can be really tough on people, both physically and emotionally. It's not just the discomfort.
Right.
It's also the constant need to go to the bathroom and the fear of getting another infection.
So it can really affect their daily life.
It can. Some people start to avoid social situations or intimate relationships because they're afraid of triggering another infection.
Right.
And that can lead to isolation and even more stress. So it's really important for us as healthcare providers to acknowledge and address that psychological impact.
Right. Treat the whole person, not just the infection.
Exactly. We need to be supportive and understanding and help our patients manage the emotional side of dealing with recurrent UTIs.
Okay. Now, I want to bring up something that's been a recurring theme throughout our conversation: antimicrobial resistance.
Yeah.
We've talked about the challenges it poses for treating UTIs. But how do you see the issue evolving in the future, and what can we do about it?
Antimicrobial resistance is a major threat, and it's not going away anytime soon.
Right.
It's a complex problem, and it's going to take a lot of effort from everyone to solve it. Individuals, healthcare systems, governments, we all need to work together.
So where do we start? What are some of the most important things we need to focus on?
Well, I think one of the biggest things is reducing unnecessary antibiotic use. We need to be more careful about prescribing antibiotics. We need to educate patients about when they're really necessary.
Right. And when they're not.
Exactly. And we need to explore other treatment options for infections that don't necessarily require antibiotics.
So it's about changing how we think about antibiotics.
It is. We need to see them as a valuable resource that we need to protect.
Okay.
And we also need to focus on preventing infections in the first place.
Okay. How do we do that?
Well, we need to strengthen infection control measures in healthcare settings.
Okay.
Promote good hygiene practices in the community. And we need to develop new vaccines and other preventive strategies.
And I imagine research is going to play a huge role as well.
Absolutely. We need new antibiotics,
Right.
new ways to treat infections. We need to invest in research and development to stay ahead of the curve.
So it's a multi-pronged approach.
It is. It's a global effort, and we all need to be involved.
Okay. So let's talk specifically about microbiology labs and their role in tracking antibiotic resistance. How important is that surveillance data?
Microbiology labs are essential in the fight against antibiotic resistance.
Okay.
We're the ones who are tracking the trends. We identify emerging resistance patterns,
Okay.
and we give clinicians the information they need to make the right treatment decisions.
So you're like the eyes and ears on the ground.
Exactly. We're constantly gathering information and sharing it with the people who are treating patients.
What are some of the challenges you face in collecting and sharing that data?
Well, one challenge is making sure that the data is being collected consistently.
Okay.
We need standardized methods.
Right. Everyone doing it the same way.
Yes, so that we're comparing apples to apples and we're getting an accurate picture of what's really happening out there.
Makes sense.
And once we have that good data, we have to make sure it gets to clinicians in a way that's useful.
So it's not just about collecting data, it's about making sure it's used effectively.
Exactly. We have to work together with clinicians, be partners in this fight.
Now, I want to touch on a topic that's been getting more attention lately: the gut microbiome and its potential role in UTIs. Can you tell us a little bit about that?
Well, we're learning more and more about the gut microbiome
Right.
and how it affects our health. And it turns out that the bacteria in our gut can actually influence the bacteria in our urinary tract.
So it's not just about the bacteria in the bladder.
It's not. The gut microbiome can impact whether someone is likely to get a UTI.
Interesting. So if something disrupts the gut microbiome, like taking antibiotics, could that increase the risk of UTIs?
It could.
Okay, so how does this new research impact how we might treat UTIs in the future?
Well, it's still early, but there's a lot of interest in using things like probiotics and fecal microbiota transplantation to try to restore a healthy balance of bacteria in the gut.
So it's about manipulating the bacteria in the gut to try to prevent UTIs.
Exactly. It's a promising area of research.
So we've covered a lot of ground today. We've talked about how complicated it can be to diagnose and manage UTIs. We've discussed antimicrobial resistance.
It's a big topic.
It is. And we've even looked ahead at potential new treatment approaches.
It's been a great discussion.
It has. And for those who want to dig a little deeper, I highly recommend the WHO-aware antibiotic book.
A great resource.
Yes, especially for medical microbiologists. So before we wrap up, I want to leave everyone with a question to think about. With antimicrobial resistance constantly changing, what are some new strategies that we, as medical microbiologists, can use to improve how we diagnose, treat, and prevent UTIs? How can we make sure we're using antibiotics wisely and preserving their effectiveness for the future?
That's a really important question. I think we need to start by thinking about UTIs in a more holistic way, not just about identifying the bacteria and treating it.
Okay, so what does that mean?
It means thinking about prevention,
Okay.
encouraging good hygiene practices, exploring alternative treatment options like probiotics and phage therapy. We also need to be vigilant about tracking antibiotic resistance patterns, educating patients and clinicians about responsible antibiotic use, and working with researchers to develop new antibiotics and new treatment approaches.
So it's about taking a much broader approach to this problem.
It is. We need to see the big picture and work together.
Well said. And it sounds like we need to be a little bit more proactive, not just reacting to the problem, but trying to get ahead of it.
Absolutely. It's about being innovative and thinking about UTIs from different angles.
Right. And thinking about the patient as a whole person.
Exactly. We have to consider all the factors that might be contributing to their UTIs, not just the bacteria itself.
So thinking about the patient as a whole person, are there any lifestyle changes or behavioral modifications that can help prevent UTIs or reduce recurrences? Things people can do on their own?
There are. Staying well hydrated is so important.
Okay, so drinking lots of water.
Yes. Drinking plenty of water helps flush out bacteria from the urinary tract.
So it's like washing out the pipes.
Exactly. And for women especially, wiping from front to back after using the toilet is really important.
Okay, right.
It helps prevent the spread of bacteria from the anal area to the urethra.
So simple things that can make a big difference.
Absolutely. Small changes can have a big impact on your health.
Now, what about cranberry products? We hear a lot about cranberries and UTIs. What's the real story there?
Well, the research on cranberries is a bit mixed.
Oh, good.
Some studies have shown that cranberries contain compounds that can prevent bacteria from sticking to the bladder wall.
So it might help reduce the risk of infection?
It might,
Right.
but it's not a foolproof solution. And you have to be careful with cranberry juice because it can be high in sugar.
Right, so cranberry capsules might be a better option for some people.
They could be, yes, less sugar.
Okay, so hydration, hygiene, and maybe cranberries. What about other lifestyle factors like diet and exercise? Can those things influence UTIs?
Absolutely. A healthy diet and regular exercise are good for your overall health, and that includes your immune system. A strong immune system can help fight off all sorts of infections, including UTIs.
So it's about being healthy in general.
Exactly. And managing stress is important too.
Okay, how does stress play into it?
Well, stress weakens the immune system.
Right.
And when your immune system is weak, you're more susceptible to infections.
So it's all connected.
It really is. Your physical health and your mental health are intertwined.
Okay, so we've covered a lot of ground today, from diagnosis to treatment to prevention. Any final words of wisdom for our listeners, those amazing medical microbiologists working hard in the labs?
I would say, remember how important your work is. The tests you run, the data you collect, it all makes a difference. It helps clinicians make the right decisions for their patients.
We're all part of the team.
We are. And communication is so important.
Okay.
We need to be talking to each other, sharing information.
Right, the lab and the clinicians working together.
Exactly. We need to be partners in this fight against UTIs and antimicrobial resistance.
Couldn't agree more. And we need to be willing to learn and adapt because this is a constantly evolving field. New challenges, new opportunities.
Absolutely. It's an exciting time to be a medical microbiologist.
It is. Well, on that note, I think it's time to wrap up our deep dive into the fascinating world of lower urinary tract infections. I hope everyone found it informative and helpful. Remember, the more we understand about these common infections, the better equipped we'll be to fight them. So until next time, stay curious, stay informed, and stay well.